As a nurse or nurse practitioner, we often have to discuss or ask questions regarding sensitive topics such as sexual orientations or menstrual history. Depending on your setting, we may only have very limited time to build a rapport with a patient and discuss such sensitive topics. In this episode, I'm going to talk about 5 tips to make patients feel more comfortable when we discuss sensitive topics. Aloha, I'm Miki Miura, a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years and I absolutely love being a nurse practitioner and the lifestyle that Korea has given me. My passion is mentoring nurse practitioner students and new grad nurse practitioners to build amazing careers so that they can have the freedom of choice on what they want to do and how they want to live. Alright, let's get into it. As I work in women's health, I talk about various sensitive topics with my patients, such as menstrual history, sexual history, and we also provide STI management screening for all patients. So over the years, I learned some tips on how to make patients feel more comfortable when we talk about those very sensitive topics. First tip is to build a solid patient-provider relationship. It is very important for a patient to trust you when we discuss very sensitive topics because they're going to share a very sensitive information with you, so they want to make sure that you are trustable, you are not going to judge them, and they feel safe with you. And in order to make them feel that way, we have to establish a good relationship. So first thing first, greet to them, acknowledge that they are respected. And of course, we have to do this for any cases, but this is particularly important when we discuss very sensitive topic. So as soon as I go in, I greet, hi, nice to meet you. I'm Miki Miura. I'm a nurse practitioner. So I greet and then tell who I am. This helps to build much stronger connection with your patient instead of, okay, next, so why are you here? And patient feel like they are just one of the so many patients that this provider would see. But instead, we acknowledge, hi, nice to meet you, or hello, I'm Miki Miura. It's very important to convey that I acknowledge them and I respect them and mention that who I am. Second tip is to inform patient about what we're gonna discuss. This is particularly important when we discuss very sensitive topics. So I may say, so do you smoke cigarettes? How about alcohol? All right, now let's talk about your menstruation. By announcing what you're gonna talk about, patients have a moment to prepare themselves because for some patients, those are very sensitive topics and they might need a moment to prepare psychologically. Third tip is to inform that patient may choose to answer or may choose not to answer. By clearly mention that they have a right to decide whether they want to answer the question or not, they can feel that they are in control and their wishes are respected. So you may say, okay, now we're gonna talk about sexual history. If you feel uncomfortable to any questions, you may say you decline to answer questions and I will respect your wishes. This way, patient will feel that they are in a safe environment and their anxiety and discomfort can be alleviated. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF Nurse Practitioner Job Interview Prep Checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF Nurse Practitioner Job Interview Prep Checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Fourth tip is to tell patients why you are asking certain questions. When patients come in for sexually transmitted infection screening, I do have to ask more specific facts about sexual activity that they engage in. When I ask those questions, I usually say, I'm asking these questions because I need to know which site I need to test for. This way, patient would know exactly what my intentions are. 5th tip is to start a sentence with many patient experience. This way, patient feel that they are not alone or this is very common, nothing to embarrass about. So I may say, a lot of women experience vaginal itching. Have you ever experienced that before? Some women may feel embarrassed to talk about it, but if I start sentence, many women experience this, do you have that? Then that patient may feel more comfortable to open up, saying, I actually do have that as well. I hope this episode was helpful for you. If you like this episode, please give me a thumbs up and make sure to subscribe to my channel. We upload a new episode every week. Also, if you have any other tips on how to discuss sensitive topics, please write down in the comment section. Alright, I'll see you in the next episode. Aloha.